Question is the most likely diagnosis in a 23-year-old, mentally alert, male dwarf with disproportionate arm and leg to body growth, prominent forehead, and retruded maxilla is A. Cretinism, B. Pituitary dwarfism, C. Acromegaly, D. Achondroplasia, E. Eagle's syndrome. Here the answer is achondroplasia. It is a most common form of disproportionate dwarfism in which child arm and leg are short in proportion to body line. While cretinism is a condition of mental retardation and dwarfism due to deficiency of thyroid hormone in child. And pituitary dwarfism is a condition caused due to insufficient amount of growth hormone. Here you see abnormal short stature but normal body proportion. And acromegaly is condition where body produce too much growth hormone which leads to abnormal large hand and feet. While Eagle syndrome is a condition associated with the elongation of the styloid process or calcification of the stylohyoid ligament, clinically characterized by throat and neck pain, radiating into the ear.
Question is the most common benign tumor occurring in the oral cavity is the A. Papilloma, B. Adenoma, C. Fibroma, D. Hemangioma, E. Lipoma. Here option C is correct. Fibroma are the benign tumor of connective tissue that are most common, and papilloma are exophytic papillary growth of stratified squamous epithelium, while adenoma is a benign tumor of epithelial tissue with glandular origin, and hemangioma is benign vascular tumor derived from blood vessel, and lipoma is round or oval-shaped lump of tissue that grows just beneath the skin. It's made of fat.
Question is failure of the tuberculum impar to retract prior to fusion of the lateral halves of the tongue results in A. Median rhomboid glossitis, B. Cleft, bifid, tongue, C. Geographic tongue, D. Scrotal tongue, E. Sarcoma of tongue. Its A option is correct. So median rhomboid glossitis is the inflammation of tongue, rhomboid in shape, caused by failure of tuberculum impar to retract prior to fusion of lateral halves. While cleft tongue is a tongue with a groove or split running lengthwise along the tip of the tongue. It is the result of incomplete fusion of the distal tongue buds. And geographic tongue is a condition that causes a map-like pattern to appear on the tongue. And scrotal tongue, also called fissural tongue.
Question is atrophy of the pharyngeal and gastric mucosa, choelongitis, spooner nails, and predisposition to oral carcinoma in postmenopausal women are features of A. Iron deficiency anemia, B. Pernicious anemia, C. Sturge-Weber-Dimitri syndrome, D. Plummer-Vinson syndrome, E. Trisomy 21. Correct option is D. Plummer-Vinson syndrome is a condition that occurs in people with long-term iron deficiency anemia in which mucosal atrophy, choelongitis, and predisposition to oral carcinoma in postmenopausal women are quite rare. While iron deficiency anemia is a lack of red blood cells and hemoglobin because of inadequate dietary intake of iron, and pernicious anemia is impaired red blood cell maturation secondary to insufficient vitamin B12 as the results of a defective intrinsic factor required for its absorption through the intestinal wall. It causes extreme malaise, tiredness, atrophy of filiform papillae. And Sturge-Weber syndrome is a specific syndrome sometimes identified with unilateral port wine stains on the face, and individual also have intracranial hemangioma and epilepsy. And last, trisomy 21 is an extra chromosome number 21, also known as Down syndrome.